So I guess one thing that parents want to know is, do the allergies make the asthma hard to treat?
Um, potentially yes and potentially no. One thing I would say that is beneficial actually in people with allergic asthma is that they tend to respond fairly well to medications as opposed to those who have non-allergic asthma, because most of the medicines are actually designed to treat allergic types of asthma. So that can be beneficial. On the downside, um, it's often sometimes hard to avoid certain allergens, which may trigger people's asthma. And sometimes those that develop asthma at an early age, sometimes who have allergic asthma, can carry it into to adulthood. So it really depends. I always tell them that everyone's asthma is different, and and we're going to treat it. We're going to treat. I always try to treat the patient and uniquely, and to figure out what's going to go on in 5 to 10 years. Sometimes difficult to know.
Um, what are some examples of ways that asthma could be different in different people?
Well, you, often, I would say the majority of the patients I see are actually have pretty stable lungs, stable asthma, and then they get a cold, and then they
Hmm.
have a flare for about 4 to 5 days, and then they're fine. And then they're fine until they get the next cold. And not every cold may trigger asthma. Some do, some don't. So I would say the most common type of asthma that I see in my office is what we call mild intermittent asthma, that it's only intermittent in nature, that they get it once or twice. They get a flare once or twice a year when they get a they get an upper respiratory tract infection. Then you may see other types that are sort of more chronic asthmatics, more persistent asthmatics.
Hmm.
Oftentimes we see those in allergic individuals, where they're going to need daily medications and may need use of more inhalers than another child. Other patients just sort of have symptoms when they exercise. We call that exercise-induced bronchoconstriction or exercise-induced asthma. So asthma really comes in a lot of different flavors,
Hmm.
and there a lot of work is going on in the hard science to try to really classify people according to the certain inflammatory molecules that they release.
Yeah.
But it's still very early, and trying to class people is often very difficult.
You know, Mark, I know this last flu season was really hard on a lot of people. Did you see a lot of people in your office because of that?
Yeah, I know. Influenza is very dangerous for asthmatics because it really can set up shop in the lungs, and so it's actually recommended that every asthmatic gets a flu shot every year.
Okay.